The endoscopic vein harvesting is introduced for quite some time. It didn't pick up for long. And if you see, previously people didn't like taking vein out, especially for ladies. You get a long scar going through all the length of your leg, and that was a cause of pain, infection, wound, and not healing. And majority of my patient is to complain that this is all okay, doctor, but my leg is still hurts and there is still a wound not healing. And this was a common factor. Endoscopic vein harvesting initially was a bit more complex. Now it's so good that we got a surgical nurse specialist who can harvest this vein effectively. You have a tiny small skin incisions on the leg, one inch per upper end and the lower end. An entire length of vein can be taken out safely, effectively, without major scars, and the quality of vein is good. And it has revolutionized the surgery or bypass operation, because previously patients had a lot of wound problem. It was as high as up to 5% because leg is closer to natural orifices, so it can have some infection problem. But since the EVH, we have almost 0% infection rate. And that's why we are promoting big vein, and I feel it should be a standard of care for most of the patient going for coronary artery bypass grafting, where you need leg vein. Vein harvesting is done while we are doing the opening the chest and taking out the mammary artery from the chest. Same time, the specialist or my assistant has a gadget, which is, I think, now marketed by, there are two companies. One of them we use the Marquee, where you put a telescope from one end and there is a CO2 insufflation. So vein can be looked at entire length. And then we have a device by which you cut the branches and coagulate the other end. And the vein can be pulled out to the small incision. Then it can be prepared for a bypass operation. There are around 2 systems available. There could be more, but a Marquee is one of the market leader, where you have a screen. It's like a video assisted. There's a video you can see under vision, and there is a telescope which goes along with it, and they have a devices to dissect. And after the dissection, you clip the branches or cut them branches with a RF forceps, and the vein can be removed outside. And then we prepare it by clipping the branches with titanium clips. Mostly we use long saphenous vein. That is a major vein in the leg. The saphenous means is superficial and it's a large vein. There are 3 types of vein in the leg. There is a short saphenous vein, which usually very rarely we take it, or they have a collateral branches of it. Arm veins are never used unless there's a desperation, because they will not withstand the systemic pressures. The leg veins are good because when you stand on it, it has got a high atmospheric pressure on it. So the diameter of vein and the paraceruncum is always constantly put to the stress. When these veins become artery inside your chest near the heart, they have a pressure of almost 120 millimeters of mercury. To withstand that, the leg veins are the best one, and saphenous vein. It's been used over 50, 60 years with a good outcome, and that's why it's a vein of choice. But endoscopic vein harvesting, the same system can be used to harvest radial veins from the arms with a small tiny incision. Can you imagine having a big scar on your arm? Looks like you're a villain or you're in some fights. So patients sometimes don't like it, but if you've got endoscopic vein harvesting, we can get a radial artery with a tiny incision, and the same system can be used. After we remove it, vein, there are tiny incisions on the leg that they are stitched with the dissolvable sutures, and then they give a crepe bandage to prevent any oozing or collection of blood. When we take out the bandage, the wound usually heals. You don't need to take any sutures out. And the vein which is removed, used for a bypass operation. It makes it very tidy, small incision. As you remember, that a bigger incision, there could be more bacteria going and causing infection. And also it's not aesthetically pleasing. Smaller incisions are quite pleasant. Because of small incision, less exposure to bacteria to go in and cause infection. So less pain, less infection chances, and aesthetically good incision. It's accepted by all my patients, and they're so happy that if I can't find or get a technician to give us a hand to take a vein out, it's better to postpone the surgery rather than doing it with a traditional incision, because it's just not acceptable in this day and age. Occasionally you have to do it, because if the vein is complex and it's difficult and there is a problem with the leg fat, then you may have to do a small incisions to take out this vein. But often it's very rare to do that nowadays.